Recently, Community Care of North Carolina released its recommendations for reforming the North Carolina Medicaid program. The following brief, narrated slideshow outlines those recommendations. CCNC believes that its recommendations can help achieve the goals of reform as outlined by North Carolina Governor McCrory this past fall. Namely, improved quality of care, budget predictability, integrative care of mental and physical conditions, lower cost, and movement toward a pay-for-performance program. This overview is organized around the major areas listed on this slide. But first, a word about the sources of North Carolina Medicaid dollars. As seen in this chart, the total Medicaid program for the state's fiscal year 2014 is budgeted to be $13 billion, 92% of which will go to providers. There are three main sources of these monies: federal dollars, state dollars, and other dollars. The majority of other dollars comes from medication rebates. Note that 2/3 of the dollars flow from the federal government. Before the Medicaid program can be fixed, it is essential to know what parts are broken. A deep dive into the Medicaid program by CCNC Central Office in Raleigh has discovered some important factors that appear to be playing a part in creating the Medicaid cost overruns in recent years. The problem does not appear to be the result of out-of-control claims spending. As shown in this slide, North Carolina has the lowest growth of claims spending in the country. Total Medicaid claims spending has grown 2.3% since 2008, despite the fact that North Carolina has seen a 4.5% annual Medicaid enrollment during the same period. So, in fact, CCNC is serving more people at a lower cost now than in 2008. However, CCNC recognizes that more can be done. This slide shows the data just discussed in the graphic form and compares our state with some others in the region. This interesting slide compares the growth of Medicaid expenditures in relation to a state's growth and overall expenditures. North Carolina looks pretty good. So, what factors have played into the recent Medicaid budget shortfalls? CCNC's analysis suggests that many administrative factors are creating these shortfalls. Although CCNC believes that our organization has been helpful in keeping Medicaid claims spending growth low, it recognizes that more can be done. The left side of this slide illustrates the Medicaid programs that CCNC manages under our contract with the North Carolina Division of Medical Assistance. On the right are programs that CCNC does not manage. CCNC believes that it has the expertise and tools to manage these additional services and save additional Medicaid dollars. Of course, in the mental health area, this management would be in collaboration with the state's mental health managed care organizations already in existence. CCNC agrees with Governor McCrory that budget predictability is essential to efficient government. This is certainly true for the Medicaid budget. CCNC has proposed that the implementation of a Medicaid global budget cap could achieve the budget predictability goal. This slide outlines how this would generally work. The strength of the concept is that it is a mechanism that brings all Medicaid providers to the table to implement initiatives and control cost. Development and implementation of such a plan would be complicated, but CCNC believes it shows a promise as a mechanism to control the cost of the North Carolina Medicaid program. Improving quality and bending the healthcare cost curve are what CCNC and its local primary care practices are all about. We have been successful at this, saving North Carolina over $1 billion in recent years. Our individual practices work with our network care managers in 4 important areas. First, our transitional care program works to assure that patients with chronic medical conditions are able to follow their hospital discharge plan. This reduces the number of readmissions. Second, network care managers work with patients who are high utilizers of emergency departments for non-emergent problems, encouraging them to appropriately use their medical home. Third, our care managers focus on the patients who have higher than expected costs compared to others with similar conditions. And finally, quality initiatives within practices improve care and lower costs for such conditions as asthma, diabetes, COPD, chronic pain, and others. CCNC's care management programs are effective. On this slide, note the per member per month PMPM cost differences between CCNC enrolled and unenrolled patients. Also note the trends in PMPM cost. Costs for CCNC enrollees are declining while those of non-enrollees are rising. Finally, as the overall health system reforms, Medicaid must also move away from a fee-for-service model to a pay-for-performance model. This will require providers to take on risks for poor outcomes, but share in the cost savings when the outcomes and costs improve. This slide outlines the complicated path to value-based care. A detailed explanation of this path is beyond the scope of this presentation, but please note that the endpoint is an accountable care organization model. For a number of reasons, CCNC thinks that this is the best way for North Carolina to get a value-based Medicaid program. We at Partnership for Community Care hope that you found this presentation helpful. If you wish to hear more detailed presentation, please go to the Community Care of North Carolina website shown on this slide to find a link to that presentation.